An NHS trust looking after some of the most vulnerable patients in Leeds has launched a campaign to tackle the problem of illicit drugs being used at the Beckylyn Centre, a specialist hospital for people with acute mental health problems.
Over the last few years, we've become increasingly concerned about the availability of drugs on our units and the impact this has on our service users.
Around about 50% of people tell us when they come into hospital that they're using illicit substances, and there's been a marked increase in women using substances.
Just like the rest of the city, we've seen problems from the new psychoactive substances such as spice, and spice can significantly and abruptly change people's behaviour and mean that people become very unpredictable in the behaviour, and that can be frightening for them.
Sometimes they take drugs to self-medicate, so the positive effects of our prescribed treatment can be lost. It's a vicious circle.
We're all struggling with this as a problem. There are no easy solutions to this. The reason for being public about it is we've acknowledged that it's a problem. We know that we need to protect our vulnerable people, but we also know that we can't do this on our own, and we need to work with the expertise in the city.
OK, right, what have you got for us then, Dan?
Sergeant Jonathan McNiff described how partnership working was helping to tackle the drugs problem.
It's unique, I think, is the relationship that we've got with the Trust, and from that perspective they've been very open and allowing us into their properties to say, help us to tackle the drugs problem. Other trusts I don't think are as forward thinking.
There'll be a number of changes that people notice. The first will be an increased police presence, largely as a deterrent and also to highlight the fact that these are illegal drugs. The second is that we'll have a sniffer dog in the unit and the grounds, because we know that unfortunately the grounds are places as well that people can use drugs, and we need to be vigilant about that.
We're not here to criminalise service users, but where it's necessary we do take positive action, and we're not afraid to take people to court. But equally the message is, where it's appropriate, we will counsel service users with the staff from this trust to be able to break that chain of people taking drugs.
I would like to reassure people that their relatives and loved ones are safe in this unit. I'd like to reassure the patients that are going to be admitted that they're safe in this unit, but I think it's important to be honest that the issues that are happening in society are also happening in here. I guess the difference with Leeds and York Partnership Foundation Trust is that we're actually speaking out, acknowledging what's happening and trying to make a difference.
It would be very easy to say, actually, this is a society's problem and society needs to solve it. We're a health trust, not a policing organisation. But we do need to take some responsibility for people's longer-term mental health and try and improve their lives.
To provide safe care for our patients is our number one priority, and to see that compromised by the use of illicit substances and the effects that that can give is why we're so committed to this campaign.